Hi, I'm Heidi Dunniway. 4 years ago, work-related injury left me unable to perform surgery. I was devastated. I felt like part of me had died. But I found a way to continue working for high-quality patient care and to be an advocate for physicians. Today, I'm the Regional Chief Medical Officer for a large health system. Basically, I find ways to make things work for patients, work for physicians, and work for the healthcare system. I love problem solving, finding ways to overcome what seem to be insurmountable obstacles and to ensure physicians always have voice. Like many of you, I've been working nearly around the clock because of COVID-19. The pandemic is driving us to reinvent healthcare delivery and to ensure practice sustainability. I work to meet these challenges daily across specialties. Now I'm ready to take that experience and my problem-solving skills to work for you as your voice on Council on Medical Service. I ask for your vote.
Regarding physician practice viability, what suggestions would you offer to physicians struggling to remain solvent?
For physicians who are struggling to remain solvent, and this is such a broad issue at this point, I think that there are several resources out there. The AMA and also our specialty societies have presented several in terms of reinventing what your practice looks like. Telehealth is clearly going to play a big role in this. Many of our medical associations, including here in Indiana, our state medical association has helped provide physicians with access to those platforms. So I think really thinking outside of the box. The other piece of it, I think, is working closely with our hospitals. And that's part of what I do on a day-to-day basis is work with our various specialties and also primary care to really start getting our services up and running and helping to do that in a very safe way so that we can work in a partnership and get patients cared for. I think we're also going to have to just be very creative over the next several months, figure out how to take care of patients where they are.
What do you see as the current challenges of telehealth now and beyond the pandemic?
Telehealth has been a modality that we have had a lot of discussion about. We've been using the more in limited quantities over the last few years. I think the pandemic is driving us to adopt the technology. I think naturally as physicians, we sometimes are slow in moving to technologies that we're just not so comfortable with. The challenges with telehealth, I think, one, are our own comfort and determining how we can best work within that environment. And there are many resources out there to do that. I think the other big challenge I see, and I've seen this day to day within my own system, working with both hospital-based specialties and also office or ambulatory specialties, is accessibility. We have large segments of our population that simply do not have the devices and do not have the connectivity. I think that's going to be a societal issue that we really need to address. And it's going to take some partnerships to do that, to meet that and close some of those social disparities so we can reach those patients.
What are your thoughts regarding healthcare reform? Specifically comment on single payer and public option.
Healthcare reform is a very broad question. With respect to different systems, including single payer, I think we need to look at all options as we have been for several years. The pandemic certainly reshaped some of that discussion. I also think we need to look at what is good about single payer and what is not as good. I have extensive experience with the VA because my own husband is a retired Marine who has a service-connected disability. That system just does not serve those patients as well as it needs to on a consistent basis. That is one of our models in the U.S. that we could potentially build on, but there are definitely some issues we need to address. I also think that there needs to be some leveling of the playing field for physicians with respect to some of the large companies that are managing insurance at this point. Public option, I think, does need to be available. We need to have something accessible for patients, and the marketplace has not answered those needs for many patients, particularly with high deductibles.